Hey everyone, today we're going to talk about something that can feel pretty huge, the Da Vinci hysterectomy. If this is a decision you're facing, I get it. It can feel really overwhelming. So our whole goal here is to just break it all down, cut through the complexity, and give you the straightforward information you need to feel more confident and in control. Let's jump right in. So here's our game plan for today. We'll start with the basics, what a hysterectomy even is. Then we'll get into the specifics of the Da Vinci system. What's the advantage there? After that, we'll cover the really important stuff, like the risks and your alternatives. And finally, we'll walk through what the road to recovery actually looks like. All right, let's start at the very beginning. Section 1. What exactly is a hysterectomy? We're going to get into the why behind this whole procedure. So, on the surface, it's simple. A hysterectomy is a surgery to remove the uterus. That's the textbook definition. But, while that sounds straightforward, the reasons why someone might get to this point are anything but simple. They're deeply personal and often really complex. This surgery usually comes into the picture for some really serious and painful conditions that just haven't gotten better with other treatments. We're talking about things like uterine fibroids, endometriosis, or just chronic, debilitating pelvic pain. For so many, this surgery is a huge step toward getting their life back. Okay, so where does the Da Vinci part come in? What's with the robot? Well, think of your surgeon as a master pilot sitting at a high-tech console. They're looking at this amazing, magnified 3D view from inside your body, and they're using controls to move these tiny robotic arms with incredible precision. But, and this is super important to remember, the robot isn't doing the surgery on its own. It's a tool that just enhances the surgeon's own skill. So that's the tech side of it. Pretty cool, right? But what does all that technology actually mean for you, the patient? Let's look at the real-world advantages of this approach. And this is where you can really see the difference. I mean, it's practically night and day. With traditional surgery, you've got one large incision. With Da Vinci, it's just a few small ones. A hospital stay that could be several days is often cut down to 24 hours or less. And that 6 to 8 week recovery, it can be significantly shorter. These are not small changes. They can dramatically improve the entire surgical experience. And the good news doesn't stop there. Medically, patients often have less blood loss and less pain after the surgery, which also means a lower risk of infection. On top of that, the scars are much, much smaller. And for the surgeon, that incredible 3D vision gives them a level of precision that can be a total game changer, especially in more complex cases. Okay, so we've talked about all the benefits, but it's absolutely crucial that we have a balanced view here. Any major surgery comes with risks, and to make an informed choice, you have to understand them. So let's get into that reality check. This is the question you absolutely have to dig into with your doctor. Being truly informed isn't just about knowing the good stuff, it's about understanding the potentially challenging parts of the procedure too. I think it helps to break the risks down into a few buckets. First, you have the risks that come with any major surgery, period. Things like bleeding, infection, or a reaction to anesthesia. These are possibilities no matter the technique. It's also important to know that sometimes, for safety, a surgeon might need to switch from a robotic to a traditional open surgery right in the middle of the procedure. Now, what about risks tied specifically to the robot? Well, these surgeries can sometimes take a bit longer. And while it's extremely rare, there is a small possibility of a system malfunction or an injury from the surgical instruments. Of course, your surgical team is highly trained to manage these unlikely events, but it's something to be aware of. And finally, there are the profound consequences of removing the uterus itself. This is the big one. It means the permanent loss of fertility. And if the ovaries are also removed, it triggers immediate menopause. These are life-altering changes that require deep, careful discussion with your doctor and your family. And all this brings us to a really empowering part of the conversation. A Da Vinci hysterectomy is a powerful tool, but it's not your only option. Understanding the alternatives is the key to making the best possible choice for you. So depending on your specific condition, your journey might start with medical management, like hormonal therapy. If surgery is definitely needed, there are other ways to do it, like traditional open or standard laparoscopic procedures. And in some cases, there are even uterine-sparing surgeries that can treat the problem without removing the uterus. The key takeaway is that you have a whole spectrum of choices to discuss with your provider. So let's say you and your doctor decide this is the right path forward. What does that road to recovery actually look and feel like? Well, the timeline is generally pretty manageable. Most patients are able to go home within a day.
Then, in those first couple of weeks, you'll just be easing back into light daily activities. And by 4 to 6 weeks, most people get the green light to return to all their normal activities, including exercise. It's a phased approach to healing. A safe recovery means knowing exactly when you need to call for help. A high fever, severe pain, heavy bleeding, or any signs of infection from the incisions, these are your signals to contact your doctor's office immediately. Please, don't hesitate.
So, when you boil it all down, what's the core takeaway? Well, the Da Vinci hysterectomy offers a modern, minimally invasive option with clear benefits, like less pain and a faster recovery. The decision really rests on weighing those advantages against the risks that come with any major surgery.
And that brings us to the end. Our goal today wasn't to give you an answer, but to empower you to ask better questions. So, armed with all this knowledge, what's the first question you'll ask your doctor to find the best path forward for your health?